for temperature, first we must assess the clinical signs for hypothermia, assess the site of most appropriate for measurement, and also assess the factors that may alter core body temperature of the patient. For pulse, we must assess the clinical sign of cardiovascular alteration other than the pulse rate, rhythm, or the volume. We must assess also the site of most appropriate for assessment and assess the factors also that may alter the pulse rate of the patient. Now for respiration, first we must assess the skin and mucous membrane color of the patient. We must assess the position assumed for breathing. We must assess the chest movement and chest pain. We must assess the activity tolerance. We must assess the site of several anorexia. And we must assess also the medication that may alter the respiration. Before we do the planning, we must determine the policies and procedures of the facility. We must also determine the medication record of the patient that may increase or decrease the client's temperature, respiration, and cardiac activity. For the planning, we will need to assemble the equipment and supplies that we will need in these procedures. For the assessing of temperature, we must need a thermometer, a pair of gloves if necessary, tissue, wipes, or cotton balls with alcohol. For assessing the respiration and pulse rate, we must need a watch with a second hand or indicator. The first step in this procedure is the give. With the client, introduce yourself, verify the client, and explain to the client kung ano nga ba yung gagawin natin sa kanila. Good day, ma'am. I am Vince Gerald M. San Miguel, a nursing student from Nueva Ecija University of Science and Technology, batch 24. Ang magpa-perform lamang po ako ngayon sa inyo ng vital signs. Ano po pala yung pangalan niyo, ma'am?
Geraldine San Miguel, nurse.
Ilang taon na po kayo?
45.
So, yung vital signs po natin ngayon ay kukunin po sa inyo is yung pulse rate niyo po, yung respiration niyo po, and yung temperature niyo po. Okay lang po ba yun, ma'am? Step 2. Wash your hands or perform hand hygiene. The rationale behind this is to protect your client and protect yourself for the cross-contamination that may happen. Step 3. Close the window or curtain or door to provide privacy for the clients.
Place your client in appropriate position, but since the position of the client right now is comfortable to her, I didn't do that anymore.
Next, clean the thermometer from tip to the body. And dispose it. As a male student nurse, I will ask the client to put this thermometer on her axillary to prevent the discomfort that may felt the client. Next, while taking the temperature, I will take the pulse rate of the client using 3 fingers. The rationale behind the 3 fingers is to para mapakinggan po natin ng maayos yung pulse po ng patient po natin. Palagay na lang po ito sa inyong axillary.
Count the pulse rate of the client with 60 seconds. Also assess the pulse rhythm and volume of the client. When the thermometer beeps, do not pick it up yet and wait after you finish assessing the pulse of the client, because some movements can affect client's pulse. Read the temperature of the client.
After using it, now clean the thermometer from body to tip. And dispose the bottom. After taking his or her temperature and pulse rate, now we will proceed for taking the respiration of the client. We will use the hands where you palpate the pulse rate of the client. Then put it on her diaphragm. The rationale behind this is to prevent to think of the client we will taking his or her respiration. Then, for the checking of the respiration, count the inhalation and exhalation for 60 seconds.
To be clear, we will count 1 inhalation and 1 exhalation as 1 count. Observe the depth, rhythm, and character of respiration. Observe the respiration for depth by watching the movement of the chest. Observe the respiration for regular or irregular rhythm. Observe the character of respiration, the sound they produce, and the effort they require.
After that, perform hand hygiene or hand wash to prevent yourself for the cross-contamination. For the evaluation and documentation, first, document all gathered data in credit sheet of the client. Next, report for abnormal results. And lastly, documents the procedure in the client's record book. Again, this is Vince Gerald M. San Miguel, a first-year nursing student from Nueva Ecija University of Science and Technology. Thanks for watching.